People often ask where they should actually be injecting the fillers, and it really depends on the part of the face that you are targeting. It also depends on the thickness of the filler that you are using. Different parts of the face have to be injected at different depths, and this can generally be classified into the superficial injections, which are just underneath the dermis, or you can have the injections that go into the deep dermal area, and some injections are placed subperiosteally. We shall now go into the markings of the different areas of the face. If we are injecting the nasolabial region, the first thing is to draw out the little alar triangle, and then marking out the rest of the nasolabial region and the nasolabial fold that has been formed. The injections on the alar triangle are done in a fanning technique, so the needle would go in at this point here, as far up as this sort of region here, and then injected in a retrograde manner. Prior to withdrawing the needle completely, change direction of it and build the middle area up, and then once again, prior to removing the needle, again turn it around and build up the inferior border of the triangle. This injection technique is known as the fanning technique and will build up the alar triangle. We then need to augment the rest of the nasolabial fold region, and this is done by placing the needle against the skin as a measurement, which will then give you a guide as to where to put your needle in. Most of these injections are done about 30 to 45 degrees, and once again, when the needles penetrate to the skin and reaches the apex of the triangle, the injection is done in a retrograde fashion, and this extends all the way to the base of the nasolabial folds. It's important to remember that the bevel should be facing up, and if whilst you're doing the injections you can see the outline or the greyness of the needle, that indicates that you're perhaps a bit too superficial and you should withdraw the needle and reposition it. In this video we shall show the marking for the marionette lines. Assess where the marionette lines form on the patient. These normally form in an inverted triangle sort of shape at the corners of the mouth. There are various techniques of injecting this region. One of the techniques is using the fanning technique by introducing the needle at the angle of the triangle and once again fanning out to build up the entire area. This can be combined with cross-hatching, with an injection coming at this angle as well to augment the filler that has been placed in the fanning technique. This helps build up this corner of the triangle significantly and can help correct the marionette lines. The next area we will cover will be injecting of the lips. It's very important to assess from the patient what exactly she requires. If the patient wants the lip border augmenting, or does she want the lip body augmenting? We shall go through the different techniques of filling up the border first. It's important to delineate the border of the lips, including the Cupid's triangle, the Cupid's bow, and also to delineate the philtral columns. These injections along the lip can be slightly more painful, and it's important to ensure that you have applied the topical cream for long enough. Some people often combine these with local anesthetic blocks within the mouth as well. The technique to inject along the lips usually involves starting off at this region, doing a retrograde technique all the way to the base of the corner of the mouth, and then going in separately to build up Cupid's bow on both sides prior to completing the injections on the other side as well, and once again in a retrograde manner. If the patient wants a little bit more lip show, This can be done by injecting the philtral columns in a linear retrograde fashion, and this helps evert the upper lip and can give the appearance of a fuller upper lip. The injections for the lower lip can also be done along the border of the lip. And once again, most people tend to augment the central portion first before completing the two sides. It's very important to note how much filler you've placed on each side and try and ensure you're placing a similar amount on the other side as well. Lips tend to swell up very quickly, so please warn the patient that for the first 24-48 hours they may indeed have significant swelling to this region. There are various other techniques for augmenting the lip, and these injections can include injecting along the wet-dry border by gently everting the lip and focusing on the wet-dry border of the lip and injecting along this line. This tends to give more body to the lips. Recently, people have also started augmenting the lips by placing the needle on the external surface of the upper lip region and introducing it to the area they wish to fill up as well. We shall now discuss the injection technique for the dynamic lines along the lips. These are more common in the more mature patient as well as smokers. These can be marked out by asking the patient to purse their lips and marking them out as shown here. There are once again different techniques of augmenting these areas. There are various techniques of augmenting these dynamic lines. The needle can be introduced at the base, and then injected in a retrograde fashion. An alternative to this is introducing the needle at the angle of the mouth and building up this entire region in a fanning technique, which can be combined with the cross-hatching technique that we talked about. If a patient has significant dynamic lip lines on the upper lip, these can also be softened by using the fillers in conjunction with a small amount of Botox on the upper lip region. The next region we shall discuss injecting will be the malar or the cheek region. The way to mark this is to mark out Hinderer's line. This maps out the area of the cheek that should have the maximum projection. The marking is done by drawing a line from the alar to the tragus, and then drawing a separate line from the lateral epicanthus of the eye to the angle of the mouth. The point where the two lines bisect is the area that is usually built up for the cheek or maxillary region. These injections are usually done at almost 90 degrees and tend to be much deeper and are usually done subperiosteally. This tends to be the depot technique, but you may need to move your needle around in order to completely fill the area out. The process can then be repeated on the other side. And once again, it's important to keep note of how much product you've put on each side. It's very important to analyze the patient's face prior to doing these injections, as you often find that one area of the face is slightly more deficient in volume than the other side. This should be taken into consideration when injecting the product, as you may need to inject more product on one side to balance out the face. The next area we shall discuss is injecting the tear trough region. The tear trough area is an advanced technique and it's very important to really assess the patient thoroughly prior to doing the injections. As with the maxilla, most patients you will notice have one side which is slightly more depleted in volume than the other side. This again should be taken into consideration whilst doing your injections. You need to assess each patient on their individual merits prior to commencing with the injections. The first thing to do is to mark out the tear trough region and discuss with the patient what areas particularly concern them. There are different ways of augmenting this region. You can use the traditional needle and putting small depots of the product along the tear trough region. Another way of doing this is by using the cannula technique. In this technique, a green needle can be used centrally to make a small incision. A blunt cannula can then be introduced through the hole that you have made, and this can be then turned around and you could fill up the entire tear trough region through the one tiny little incision you've made with the green needle. The cannula technique is generally more preferred in this region as there's a slightly less risk of causing vessel damage in this very vascular part of the face.